Welcome to the BioWhisperer channel. Our topic today is on a perspective overview of the medical ultrasound technologies and to provide a discussion on how it works. Ultrasound is composed of sound waves with frequencies which are significantly higher than the range of human hearing, greater than 20,000 Hz. In an ultrasound exam, a transducer, probe, is placed directly on the skin or inside a body opening. To enhance the ultrasound, waves are transmitted from the transducer. A thin layer of gel is applied to the skin through the gel into the body. This permits viewing inside the body, where tissue structures can be observed through the reflection of the waves captured as echoes of the body's structures. The strength, also known as the amplitude, of the sound signal and the time it takes for the wave to travel through the body provide the information necessary to produce an image. Some of the benefits of using ultrasound is it captures, in real time, without using ionizing radiation exposure and minimal invasiveness associated with the procedure. The ultrasound device is relatively portable and can be brought to the bedside for patient examination. The strength, amplitude, of the sound signal and the time it takes for the wave to travel through the body provide the information necessary to produce an image. It is a useful medical tool that can help a physician evaluate, diagnose and treat medical conditions for over 15 years with a safety record. Whilst ultrasound can still heat up the tissues slightly, we might ask if there are any long-term effects associated with ultrasound use as there are no current studies exploring that. Medically indicated examinations ordered by medical practitioners for the indicated purpose will reduce any chance of at-will ultrasound scan requests. Ultrasound has been integrated as a useful medical tool and common uses includes abdominal, bone, echocardiograms and many others. For instance, approaches using bone sonometry helps to assess bone fragility. Visualization of tissues such as abdominal, breast region or the heart and the blood circulation can be carried out using echocardiogram. Doppler ultrasound can be used for instance in visualizing blood flow. Doppler fetal heart rate monitors for instance allows moms to be and physicians to listen to the fetal heartbeat. Ultrasound is the most widely used medical imaging method for viewing the fetus during pregnancy. Routine examinations are performed to assess and monitor the health status of the fetus and mother. Ultrasound is also used to guide and assist with tissue sample collections and for needle placement within blood vessels for instance. Sound wave is typically produced by a piezoelectric transducer where strong, short electrical pulses drive the specific frequencies. Modern equipment deploy digital antenna array techniques where the piezoelectric elements in the transducer produce echoes at different times. This enables flexible direction and depth of focus adjustments. Sound is focused to produce an arc-shaped sound wave from the face of the transducer which travels into the body, coming into focus at a desired depth for real-time visualization. Sound focusing is assisted by the shape of the transducer, having a lens in front of the transducer, or through beamforming or spatial filtering techniques. More commonly, a water-based gel may be applied to enhance transmission of sound waves into the tissues as a form of impedance matching to reduce air gap where air triggers impedance via total reflection of sound. I would thank you for helping to share your love for this science channel by clicking the like button and subscribe for future updates. With that out of the way, let's continue the discussion. Echoes, returning sound waves, vibrate the transducer which in turn convert the vibrations into electrical signals to give digital imaging. Ultrasound scanner evaluates echo strength and timing received to adjust pixels within the image with appropriate illumination and intensity. The strength of the echo determines the brightness setting. Stronger echo gives white and weaker echo gives black. amongst a shade of gray intensities, giving rise to the displayed image feed. Placement position matters. Most ultrasound examination is done using a transducer on the surface of the body. But improved visualization is often possible if a transducer can be placed inside the body. Special use transducers for applications, such as endovaginal or endorectal uses, have been deployed. It is to be, however, noted that ultrasound produces heating, pressure changes, and mechanical disturbances in tissue, hence the need for trained personnel to operate the equipment. There are various operating modes associated with sonography. The more common one is the motion or M mode, where pulses emitted in quick succession can give rise to sequential images that can be recorded as a video. Mode A associated with amplitude and Mode B associated with brightness are other instances of the imaging modes available. Newer modes in development and optimization includes the harmonic and pulse inversion mode. The Doppler mode, for instance, is optimized for visualizing blood circulation. Shown on the screen is just some recent innovations in healthcare devices. For instance, Philips, a major electronics manufacturer, also have a medical device division, and they have come up with advanced ultrasound equipments that enable lifelike three-dimensional images. Advanced equipments offer improved photorealistic rendering and the ability to change the location of the lighting source on three-dimensional ultrasound images. Improving the integrated ultrasound imaging systems and their connected reporting systems will help to streamline the workflow process. Automation of time-consuming tasks, quantification, and picking out the ideal image slice from a three-dimensional dataset is starting to be performed by artificial intelligence, where full or semi-automation modes will smoothen the workflow. We can expect new ultrasound visualization methods, development of imaging modes, as well as enhanced miniaturization in enabling more portable devices to be available in future. Mobile app-based analyzers might help bring about quicker diagnostic sharing from medical imaging facilities to the medical doctors as well. See you in our next video. I would thank you for helping to share your love for this science channel by clicking the like button and subscribe for future updates.